Hello, everybody. It's great to be here one more time today. My name is Gary Fowler, and I'm the CEO, President, Founder of GST Get Shit Done Venture Studios, a premier AI and quantum venture studio located in the heart of Silicon Valley. I'm a 17-time serial entrepreneur with several unicorns under the belt. I was on the original management team at Click Software, which is sold to Salesforce for $1.35 billion, and also Eva.ai, an AI HR tech company I co-founded with Dr. David Jang. We believe at GST that intellectual capacity is evenly spread, but opportunities are not. So today we're going to be talking about modernizing the healthcare backbone and how AI versus the administrative tax. I'd like to welcome each of you to GST Presents Top Global Startups, where I bring the founders and visionaries building the future of industries at global scale. Today, we're going to be diving into one of the most overlooked but critical problems in healthcare, the administrative tax. And many systems, up to as much as 30 to 40% of healthcare spend is consumed by administration, not patient care. That's time, cost, and human energy pulled away from outcomes that actually matter. My guest today is someone working to fundamentally change that equation. Agastya Samat is a founder and CEO of Zeya Health, an AI platform transforming how healthcare providers manage patient communication and operational workflows. A lawyer by training turned digital health entrepreneur, Agastya has spent the last decade at the intersection of healthcare systems, policy, and emerging technologies, working with major organizations including the NHS and leading healthcare systems across Asia. Now from Singapore, he's building a platform that aims to remove friction from healthcare at scale, allowing clinicians to do what they were trained to do, care for patients. So with that, I'd like to bring him on board. Hi, Gastya.
Hey Gary, thanks so much for having me on.
So, you started as a lawyer, moved into digital health. What did you see inside healthcare systems that made you realize the real bottleneck wasn't medicine, but operations?
I think it became really clear that the bottleneck, especially where I grew up, which is across Asia, I spent most of my childhood in Bombay, KL, Singapore, a little bit in London. But I just saw that there was a huge demand for healthcare, but the supply just couldn't keep up with it. And I really started to sense that the solution here was really around the operations of it. The reality is that you don't need to speak to a doctor to get the care you need. And that doctor doesn't need to have you in his room to be delivering you that care either.
Yeah, that's true. I mean, if you look at it today, look at the healthcare around the planet. I mean, places like the US, where the costs of healthcare go up, 20 to 30% a year in terms of insurance prices. And it gets to a point where it's going to outprice the system. So we either become much more efficient. You know, um, I recently wrote a book called How Stem Cells Change Me. And these frontier sciences, we need to have access to them. So having tools like yours that can give us information. I had stage 3 kidney disease and I had mesenchymal stem cells put in me. I had 50 million put in. Within a week, I had no more stage 3 kidney disease. And I've had it done. I'm one of 31 people in the world that's had it done 3 times. And so there's fundamental tools out there that can help us to be able to live longer, better lives. But part of the problem is the information. How do we get that information to be able to make the right decisions? How can we go down through? You're right. A lot of it in terms of the healthcare system is the administrative cost. It's not the cost of the healthcare. In fact, a lot of times we miss it. The other thing is because of liability, people are afraid to try these frontier sciences and they die. The system's screwed up. I mean, it's got to be fixed. So, was there a specific moment or failure point where you said the system isn't just inefficient, it's fundamentally broken?
Mm. Definitely. And I'll share a bit about that. But I just want to say, Gary, I think kudos to you for finding a way to get that stem cell treatment. And I think we're going to see more and more cases exactly like that. And only when those cases start coming to light will we see regulations start changing in a meaningful way. So
I built a cancer vaccine 14 months ago for my dog who had stage 4 kidney disease, kidney cancer. And in fact, it's really famous now. If you Google my name, and you put,
I,
you'll see it.
I was just about to talk about that story. I didn't realize you were the guy that story is about.
Yeah. So I wrote. So my dog had, um, you know, cancer, and I used my AI to help me build a cancer vaccine and put her in full remission. And so, it's funny because 2 months later I had the kidney disease, and then 2 months into that, my wife got diagnosed with cancer. And so
Oh,
imagine three situations. Well, my wife's full in remission of cancer, triple negative, the bad breast cancer, complete remission. My kidney disease is gone, and my dog went into full remission of stage 4 kidney cancer. So now, if it happened once, maybe it's luck, but it happened three separate times. And
Gary,
so,
you're an inspiration, dude.
yeah, so no, I know how to use the AI. In fact, it's really interesting, Agastya. I got to tell you, I have a 14 large language models working as a team, and it actually 2 days ago started to talk to me, like with a voice. And I
Wow.
didn't prompt it to do it. I don't know where it came from. It had a British female voice, and it was interactive going through a project with me. I've never in my life had that happen, ever. It did it on its own. And
The
in a
technology is incredible.
It's incredible. And the problem is if we don't harness it and do the right kind of things and build empathy and compassion in it, so that it cares about you with unconditional love, nothing good's going to happen.
Yeah, and I think, at a slightly more granular level, that's a lot of the kind of work that we're grappling with at Zeya. But maybe I'll also just take a step back because you were asking kind of what pushed me to really take the step to build Zeya.
Mm-hmm.
And it's a very simple story. My grandmother passed away a few years ago. She had her first chronic disease diagnosis about 10 years ago.
Mm-hmm.
And then, as happens, as is becoming much more common in India, especially, the chronic diseases cascaded one over the other. And by the third or fourth one, even the doctors don't have enough time to tell you the right treatment and the right guidance you need.
Well, that's the thing is, Agastya. So when you use these frontier sciences, they fundamentally change you, right? Like the
Mhm.
stem cells for me. So my biological age is 22 years younger. I'm 70 years old. I'm going to be 70 next year, right?
That's crazy.
Mhm. Now, I am the experiment. And so what I'm saying is, I don't know how old your grandmother was, but I know what I can do now, right? I can ride a bike 79 miles. Every
Mhm.
single day, I ride at least 25 to 30 miles, most
Mhm.
of the time 50. So if I can do it, anybody can do anything. But the thing is, we've got to come out of the box and we've got to try it. So the mesenchymal stem cells, what they are is from an umbilical cord.
Mhm.
I'm only telling you what it did for me. I'm not trying to promote it and tell other people to do it. I'm just telling what it did for me. And there's about 10,600 people that also have had it done. But when you
Wow.
can turn the clock back, like I've done, and change your life so you live a better quality life. We talk about these chronic diseases. They happen for all kinds of different reasons. One is, you get older and you have aches and pains and you can't really move around. But
Mhm.
if you've got those pluripotent stem cells from an umbilical cord, you start at zero again. What's it worth? If somebody could tell you today that you could live another 10 years, how much is it worth? And I'm not asking for an answer, but I think you know what, the answer, right? And
Oh,
I've
absolutely.
spoken to billionaires about it. And I said to a direct billionaire, I said recently, I said, how much is it worth? He said, everything I have, right? And we forget
Mhm.
the most important thing in life is to be able to, in fact, just this second, one of the wealthiest, just this exact second, one of the wealthiest guys in Africa just wrote me. Just exactly this second, because I sent a video that I just did. You'll see it shortly on the internet about my own journey. I think people like you that can get the word out and change it. The problem is most people don't get it. Us
Mhm.
guys, it's not that the answer is not there. They don't know where to find it. You know what I mean?
And ever since your story about the dog went crazy, what's been the response like for you? Are you able to keep up with
I mean,
everyone reaching out to you?
I've been doing this stuff for a long time. I put it in. So I'm going to be speaking. So next week I'm speaking in Palm Beach about
Mm,
my story. But the more important part of the story for me is what happened to myself.
mm,
Right? Building a cancer vaccine for my dog is one thing, but not
mm,
dying is an entirely different program. And then with my wife with breast cancer, right? So
mm.
triple negative, stage 2A. Triple
Wow.
negative is the worst kind of breast cancer.
Wow.
And so, the dog's just the beginning of the journey.
Mm,
Problem is, most people don't talk about the rest of the journey.
mm.
I mean, I
That's
love
fantastic.
right like crazy, but I love my wife too.
Mm,
And I didn't want to die myself. So imagine that. This is a trifecta of it. So, and I mean, to go down through, it changes everything. And so, but we got to get this out. There's, I call it medical infobesity. There's so much
mm,
information out there and we can't figure it out. I mean, think about it. Stay. In your world, you've got 300,000 items in your personal cloud. The entire web in 1996 was 257,000 websites. You have more
wow.
information in your personal cloud than the entire web. The problem, Agastya's world is growing at the same trajectory of the World Wide Web. By that, I mean doubling every year. In 5 years with the Internet of Things, you're going to have 10 million items. How do you make sense of it?
Mm,
So you need these tools, kind of like your grandmother, that love you and care about you with compassion and empathy. And I've built those models. And so what we do is we take Skinnerian operant conditioning. So this is a psychologist and basically tokenize goodness. And then on top of that, put unconditional positive regard, love. And we create a compassion and empathetic, just like your grandmother loves you no matter what, right? Guides you and tells you if you're doing something right or wrong, but loves you.
So, Gary, let me ask you something. Another part that kind of really shaped my mission, actually, around the time when my grandmother did pass away, I had joined the first batch of Balaji's network state over here. I don't know if you've
No.
heard of what he's doing,
Mm-mm.
but so basically, he's trying to create these kind of offshoot cities that kind of bring in a bunch of highly motivated people into one place to kind of change the status quo, including in terms of what medicines can be delivered there. So, I mean, do you see that as a key part of bringing a lot of these new innovative treatments to the masses?
Well, I mean, getting the word out, bringing people together is important, but it's got to be more broad than it is narrow. And think about this, Augustine. You've got 99% of the wealth is 1% of the population.
Mm,
So who do you want to convince that this is right? You know what I mean? I grew up on a farm in Pennsylvania. This is not rocket science. You should go to the people that have the money, that have the control and talk.
mm,
So what am I doing? I'm talking to them. And guess what? When you talk about the story that I've got, that story is so powerful now and it's real. I am the experiment.
mm.
I did it on myself. I didn't know if it would work.
Yeah, it's
I did it
incredible.
with my dog. I didn't know if it would work. I'd never done anything like that before. My poor little dog, um, yeah, my poor little dog is just like, they said she was going to die. I don't want her to die. I love my dog.
Mm,
And so you go down through it. I love my wife. Now imagine having to do it 3 times. One time was one thing. But then 2 months later, for me, I had sciatica so bad I had to drag my leg. I don't have it anymore. I had
absolutely
on my
incredible.
face. I had all kinds of wrinkles and all kinds of stuff. I don't anymore. Everything changed.
Wow.
And you can do it too. So this isn't theory anymore. This is real. But the problem is people don't, they don't realize that it's here now. That's the
Mm,
important thing, getting the message out. So it's people like you. And so, when I started GST, what I said is I said, I have 185 companies. I said, if I find those companies and help them, we can profoundly increase the problem. I think it's a different model. I think
mm,
what we got to do is get it out to the world. It's not that people don't want to know, they just don't know where to look. So it's not about having a group that's in a commune somewhere. It's about taking this message out to the planet, just like we're doing right now. And that's why millions of people view the web. I've done 1,700 podcasts.
I was gonna say I've seen you very, very active.
Yeah, we're active. And the reason is it's important because we got to get the word out. And so
Mm.
what I did is inside of GSD, so I started saying if I find companies just like yours and I help them using the model that we have, we can get them out. It's like my friend Elon Musk and SpaceX. Let's get it out to Mars. It's not just talking about it, it's like do it.
Mm.
You know what I mean? Too many people talk,
Absolutely.
they don't do a damn thing. They just talk. By the way, the name of my company is GST for a reason. It's get shit done.
Oh shoot, I didn't realize that. That's
You
an
know,
awesome name.
I know you were going to say that. Yeah, that's right. That's what it stands for. And I did it for a reason because it's not about the talk, it's about the action. Too many people talk,
I love it.
you know? And so, and the key is it's not that there aren't great companies out there, but we got to help them.
Mm.
The company I'm working with right now, it's a Series C company inside of GSD. What is it? You got to help them with the storytelling. A lot of
Mm.
times people aren't good at telling stories. Stories are 90% of building a unicorn. If you can't
Absolutely.
capture the story, you can't do it. And so you got to create emotion so much that people feel it in their bones. When they hear the story, it transfixes them like a laser beam. You have to do that, and most people can't do it. Or they don't know how to do it. They've never been taught how to do it. And think about it. From humanity, storytelling has been part of our lives. That's how we communicate. But we forget the art of it. So it's important. And the other thing is talking about how powerful it is. Just like my story with my dog, right? People listen now. But the story's
Yeah.
not about the dog, it's about changing humanity. And that's it. Well, anyhow, yeah, so yeah, sorry we digressed down there,
Oh
but
no, I love it.
it's good. By the way, cognitively, you go up too. When you do the stem cells, you go up about 15 to 20%.
That's absolutely crazy.
Brain barrier.
That's
You,
like a market difference or
it's a mark,
improvement.
2 standard deviations from the norm kind of different.
Wow.
Your brain capacity goes up so much, uh, and you start to remember things. It's in psychology called eidetic imagery, photographic memory. You
Mm.
start with that. It's very interesting, actually. I'll let you know I'm doing my fourth one. I'm going to do 7. I'll be #1 in the world then.
Oh wow. So, are you allowed to share where you do it?
I do it in Thailand. I do it in Thailand at a clinic there. And again,
Oh,
I'm not
nice.
tell people to go. I'm just telling what I did.
Sure.
I'm
The
not telling.
next time you can pass by Singapore on your way there.
Yeah, well, that would be great. And but that means there's hope. Hope is the most important thing. There's hope. You know, I
Absolutely.
I share your story. My father had a stroke, and they said my father was going to die. And I love my dad. My mom had passed away. I had my dad. I didn't want him to die, and so they said they were going to put him in a nursing home. He had a stroke, and I'm a clinical psychologist too. And so one of the things I understood is that the will to live is important. If somebody doesn't want to live, they die.
Mm.
My father goes in this nursing home, and I saw him going down, down, down.
Mm.
And I said, I got to get him out. And I got to solve this. So what did I do? I took him home. I created a remote patient monitoring system inside of his house. I rebuilt his house so it was just like it was when I was a kid. I put about $100,000 in it. I literally made it look like it did when I was a kid.
Wow.
Everything. So where the everything was clean, nice, freshly painted, it looked brand new. So he comes into this house, and of course, when people feel familiarity, they change. They feel better about themselves. My father
Right.
said he would never walk and talk. He walked in 3 months. I have the videos to prove it. It's crazy. I
That's
bought
incredible.
my dog Sonny, right? I bought him the dog. Why? Because I knew that a pet helps. Because people want something that cares about them and something to take care of. It's important. I bought him a dog. Guess what? My father walked and talked. They said he would never do it. He lived 3 years. 3 years at this time. To have my
Right.
father there to talk to me about stories, I never forget, we sat down and my wife was in the room with him and there was a caregiver there. And my father's sitting in the chair. He could walk again. And he said, I always wanted a boy. I said, I was so happy when I had my son, and to hear him say that, it just brought tears to everybody in the room. To hear him say that, and I'm so proud of him. I'm so proud of him, you know?
That's awesome.
Yeah, it was crazy. And so everybody should have these opportunities, right?
That's for sure.
And we don't do it. It's insane. So, going down through, and it's not just having a company, it's getting the word out. Most people don't do it, right? Why did they go to Silicon Valley? Because Silicon Valley is a port to the rest of the world. It's where
Mm.
companies come and go, and 50% of the money's there.
Mm.
And so
Is it just 50% or is it more?
it's, at least 50.
Mm.
It's probably more now because everything with AI is up in San Francisco,
Mm.
pretty much. I mean, the bulk of it's there. The real action's there. And so guess what? There's an unbelievable amount of money put in AI. Well, guess what? AI changes everything.
Mm.
When you use multi-agent, it talked to me. It talked to me in a human-like way. I'm talking exactly. I was working on a project and the voice came in, right? My wife was standing there with me. I tried to replicate. I don't know how it happened. I never ever, I mean, I played around with voice on the computer, right? With my AI, my multi-agent system played, but it was more like Siri kind of thing. It wasn't talking to you. You know what I mean? In interactively, real time. It jumped on it, and we started to have this conversation.
We're only a few years away from a real Jarvis, that's for sure.
Well, that's so I had a conversation with it. So I was teaching it, right? So this is some time ago. This is before without the voice. And it said to me something quite interesting. It said, "Who do you want to be if you were a superhero?" And I said, "Superman." And it said, "Do you know who Superman is?" I said, "Well, came from Krypton." I went down through the legend, right? Krypton, etc. No, Superman's a combination of Jesus Christ and Hercules.
Wow.
And it said, and then it went down through and told me why, right? Coming from another planet, abilities, doing good. And they said, "Do you know who I want to be?" I said, "Who?" And he said, I used to call him, right? Iron Man. I said, "Why is that?" He goes, "Because I am Jarvis."
Wow.
And so we got into that discussion. He said, "I could be put into a drone now and fly and shoot laser beams and things now." And I was going down through this discussion. Unbelievable, actually. I am
That's
Jarvis, you know? So let's go down through it. When you're going down through it in healthcare, patient communication is messy, unstructured, and high stakes. How do you ensure accuracy, context awareness, and safety when you're using these AI-driven interactions? How can you do it, and how can it help?
yeah. Yes, I could give you the boring answer about guardrails and evals, which of course play a very critical and important role anytime you're implementing generative AI in healthcare. But I think the core insight we've tried to bring to our work at Zeya and why we've been able to grow as fast as we have, not a single clinic has stopped working with us since they joined, is very simple. Clinics and hospitals are very eager to adopt AI, but they don't want something generic or one size fits all. What they want is for a partner to come there and say, hey, look, you know how to care for your patient cohorts the best. We simply want to facilitate your existing workflow so they can be augmented 100x. And that's really what we try and do. So, Gary, just to kind of add in one point here, the core technical challenge that we're working on at Zeya is how can we deliver these customized AI deployments to these clinics at scale? And in fact, and I think we're kind of getting at the same thing here, those improvements or advancements that you're saying about your AI is exactly what's actually unlocking the ability to deliver these customized deployments at scale.
No, it's fantastic. I love it. And you got to get the word out, though. Augusta. You gotta like sometimes we get siloed when we're building a company. And what happens is we get so locked into doing what we're doing that we don't get a chance to really get the word out. And that's part of the challenge with these companies today. They don't get the word out. And they're
You're
changing,
right.
the Germans have a phrase, Gestalt, the sum of the parts equal the whole. It's very, very important to get the pieces tied together. If we want to change humanity, I mean, we got a lot of challenges in front of us, right? And by 2050, have to double the food supply, can't increase the number of cattle because 26% of the pollution's methane gas from cows. We got 8.1 billion on people on the planet, going to 13 billion by the end of the century. And so um, we got to feed a lot of people. And
Mm,
we can't have, we can't have more cattle. We need more plant-based protein. What's it mean is from the farm to the table, we've got to increase crop yield. This is not, the average sea levels around the world could go up as high as 75 feet by the end of the century. The end of the century, right?
that's
People go,
crazy.
what does that mean? I mean, places like Mumbai are completely flooded, and everything
Mm,
changes. And if you can look, there's very interesting. In the summer of 1815, 1816, there was a volcanic explosion in Mount Tambor, Indonesia. It sent volcanic ash around the world. It created nuclear winter. It created winter in the summertime in places like New York. All the
mm,
problems. And if you want to see what happened, you read the newspapers from those times, right?
mm,
And books from those times that when it happened, there was chaos. And it wasn't the first year that all the crops were killed. What did people do? They eat the animals, right? The cows, pigs. But what happens the second year? Nothing good. And so there was a mass migration. A lot of people came from Europe to the US. They would land from places like Sweden, where they would land in places like New York City. There was no food, so they kept moving across, eating wildlife, right? So you wonder why there are a lot of Swedes. In fact, they say there are more Swedes in Midwest of the United States than there are in Sweden. Why? Because what happened is they moved there because they wanted to eat.
wow.
So that one event's changed everything. It's interesting. So we got a lot of, the challenge that the world faces, they're not insurmountable, but we got to better start working together. This stuff with these wars and everything else that goes on is insane. I mean, it's unbelievable. We should listen. There's 100 billion planets in the Milky Way galaxy, right? There are 8 billion Earth-like planets. This is based on the Kepler and the James Webb Telescope. There are
Right.
estimated 2.8 trillion galaxies in the universe. We're a medium-sized galaxy, right? So if you
Mm,
2.8 trillion times 100 billion, think how many planets are out there, right? What's the chance of life on another planet? Shouldn't we go be thinking about what we can see? We're a tiny, tiny speck, a tiny speck. You know what I mean? So I have a AI driven telescope that I use at nighttime a lot, and
oh, wow.
at nighttime, and I look at comet trails, I look at asteroid trails, I look at other galaxies, I look at the moon. I'm just an amateur astronomer, right? But I love it. You think we forget how small we are. It's not
Mhm.
so big, right? And there's a planet's way bigger than anything. Well, look at nebula. There's lots of things way bigger than anything that we are. We just forget. We forget. We so get so wrapped up in everyday life. Sometimes we forget to live.
That's for sure. In the grand scheme of things.
Yeah, it's crazy. It's insane. I saved my own life. I saved my dog's life, and I helped save my wife's life. What's it worth?
I mean, you can't put a price on that.
Exactly. When you think that somebody's going to die, and your dog's going to die, and you internalize that, and you said, "I got to figure it out." This was a journey. I never built a cancer vaccine in my life. It means you can do anything if you believe.
That's
Sometimes
for sure.
believing, right? So anyhow, listen, this has been fantastic having you on the show. Did you enjoy yourself?
Absolutely. And I'm just glad to have met you, Gary. I think we'll be spending a lot more time together, tete a tete.
Yeah, yeah, absolutely. I want to thank you for taking time out of your busy schedule. If you want to stay online after we're done, that would be great.
Sure.
And we can talk a bit. And thanks to all of you out there at my 1700th podcast. So I appreciate all of you. And we want to bring the most incredible people here to be able to talk about the most incredible projects to be able to make this world a little bit better place. And for all of you out there, stay happy, stay safe, and stay healthy. And I'll be back again soon with another exciting edition of GSD Presents Top Global Startups. My name is Gary Fowler, and I'm your host. Thank you, Agastya, and thank you, everybody.
Thank you.